November marks Lung Cancer Awareness Month. It is a very important time to raise awareness, help with early detection, and know when to get checked.
Joining us today to tell us more, we have Dr. Mario Katigbak, Chief of Thoracic Surgery at Hartford Hospital. Doctor, first of all, thank you so much for being here.
Good morning. What a pleasure to be here. Thanks for having me.
Great to have you, and such an important topic here. Let's talk about why Lung Cancer Awareness Month is such an important time to not only observe, but to educate the community about early detection and screening.
Absolutely. I think what people may not realize, because some other cancers have a higher profile, is that lung cancer is actually the leading cause of cancer death. Still remains so in this country. So this year, we're probably going to have a little over 200,000 new cancer cases for lung cancer. And so it's really important for us to figure out, how do we detect these and how do we get them treated early?
Doctor, what are some of the more common risk factors and warning signs associated with lung cancer? I'm thinking smoking has to be high on that list, correct?
100%. So the biggest risk factor is still smoking. But, guys, what's really important to know is that about 15 or 20% of lung cancer patients actually never smoked. So it's just an important thing for us to know. It's not just smoking. The other big thing that we have control over is radon. So guys, a lot of times in Connecticut, you got radon in the basement. Please get that checked out.
Yeah, I always hear of that when people say that they've never smoked before, and this is something I have. That's really scary. And of course, it's more important than ever to have screening and treatment options available. So can you talk to us about what's out there?
Sure. So at Hartford Healthcare, we try to do what's called personalized medicine. What that means is that every cancer is different. Every patient is different. So we have to figure out what the right cancer treatment is for the right patient. And of course, we have all the latest and cutting edge technology. We do surgery through small incisions, the robot. But like you mentioned, I think the most important thing is really early diagnosis. It's really screening, because that's our best chance of curing any cancer, and lung cancer in particular.
Doctor, in addition to not smoking, what are some of the other things people can do to lower their risk, and how do you support a loved one who might be affected by lung cancer?
Sure. So I think that of all the things that we've done, I think early detection remains the best. Right? So what are the guidelines? Somebody from 50 to 80 years old who smoked for about 20 years or stopped smoking within the last 15 years, you need to get a screening CT scan. In the state of Connecticut, only about 25% of people who are eligible are actually getting screened. That means 75% of people who can and should get these scans actually aren't. So that would be my number one take-home message. Talk to your primary care doctor. Talk to whatever. Your providers. See if you're a candidate and eligible for screening.
Wow, so important. Thank you so much, Doctor, for talking to us about Lung Cancer Awareness Month. So important. Dr. Mario Katigbak joining us from Hartford Hospital. Appreciate your time this morning. Thank you.
Thank you so much. It's been a pleasure.
Thank you.
Thank you, sir.